Hi friend, this is Dr. Magarana from Magarasam. Welcome to my YouTube channel. And today's our topic is insulin regulations. That is how insulin is regulate the blood sugar level or blood glucose level. So let's get started. When we are having meal or when we eat food, in that food we have glucose, and this glucose enters into the stomach and intestine. This is the glucose enters into the stomach and intestine. Here it is the stomach or intestine. From the stomach and intestine, glucose get absorbed in the blood, and this is the blood vessel having blood. Once the glucose enters into the blood vessels, blood glucose level will be increased. When the blood glucose level become more than 70 milligram per deciliter, 70 milligram per deciliter, then the glucose itself enters into the beta cell of pancreas. This is glucose and enters into the beta cell of pancreas. This is the beta cell of pancreas through the GLUT2 channel. You have to remember the channel, GLUT2 channel. Glucose enters into the beta cell of pancreas through GLUT2 channel. After coming into the beta cell of pancreas, glucose get converted into glucose 6-phosphate. Glucose 6-phosphate in presence of enzyme. That the name of that enzyme is glucokinase. This glucokinase converts the glucose into glucose 6-phosphate. During this process, 1 ATP is released. 1 ATP is released. Because of this ATP, this potassium channel get inhibited. Potassium channel get inhibited. Normally, potassium influx occur. That is, entry of potassium into the beta cell of pancreas occur normally. But this potassium channel is ATP sensitive, and during the process of phosphorylations, 1 ATP is released, and this ATP inhibit the potassium channel. Because of this, potassium channels get inhibited and the membrane get depolarized. This membrane, the membrane of beta cell of pancreas, get depolarized. Because of this depolarization, the calcium channels gets open up. Calcium channels stimulates and opens up. The influx of calcium occur. This is the beta cell of pancreas. Inside the beta cell of pancreas, influx of calcium occur. Because of this influx, the insulin granules get break down and insulin is released. This is how insulin is released. And in the blood vessels, we have glucose as well as insulin. Glucose as well as insulin. Insulin. This is how glucose itself stimulates the beta cell of pancreas to causing release of insulin. And once the insulin comes into the blood, it will act on 3 target organs, that is skeletal muscles, adipose tissue and liver cells. Once insulin enters into the blood, it will act on 3 target organs: skeletal muscles, adipose tissue and livers. Liver has hepatocytes, adipose tissue has fat cells, and skeletal muscles have skeletal muscle cells. These muscle cells, these all 3 have tetramer receptors, that is insulin receptors, present on all 3 organs, all 3 target organs. All 3 target organs. From the blood, insulin enters into the target organs. From the blood, insulin acts on alpha cell, alpha unit of tetramer receptor of insulin. Insulin binds with alpha unit. Beta units get stimulated, and there is a series of IRS started. That is IRS 1, 2, 3, 4, 5. These intermediates are stimulated. Because of this intermediate stimulation, intermediate are stimulated. GLUT4 present in the cytoplasm. GLUT4 also present in the cytoplasm, and this GLUT4 moves towards the membrane. GLUT4. This membrane is nothing but the membrane of target cells, that is skeletal muscles, adipose tissue and liver. These are the target organs for the insulin. And this cell membrane is nothing but this target organ. If this target organ is liver, then this cell is hepatocyte. If it is the target organ of skeletal muscles, then it is the cell of skeletal muscle cell. Then it is the cell of skeletal muscles. If it is a cell of adipose tissue, then it is a fat cell. Once the glucose moves towards the membrane, the process is called as trafficking and docking of GLUT4. And this GLUT4 is extremely important for the glucose entry into the target cells. This GLUT4 is present on the target cells and GLUT2 is present on the beta cell of pancreas. Through this GLUT4, glucose enters into the target cells and blood glucose level become normal. And this is how insulin acts on target cells or target organs. Insulin plays an important role during meal, because during meal blood glucose level increases, but during fasting blood glucose level decreases. To become to have normal blood glucose level, then comes the role of glucagon. During fasting glucagon increases and glucagon converts the glycogen into glucose, or glucagon breaks down the glycogen or glucose. Once the glucose enters into these target organs, this glucose stored in the form of glycogen. In case of liver, glucose stored in the form of glycogen. In case of skeletal muscles, glucose also stored in the form of glycogen. Or in skeletal muscles, glucose also stored in the form of protein as well. But in case of adipose tissue, glucose stored in the form of fat cells. And during fasting, this storage form gets break down and glucose is released into the blood. And this is how blood glucose is maintained by two hormones, that is insulin and glucagon. This is how insulin is regulated. First of all, you have to know the insulin synthesis, then the insulin release, then action of the insulin. Only then you can understand the insulin regulation. Glucose does not enter into the target organs without the GLUT4. For GLUT4 to implant, there is a necessary of insulin. And who brings the insulin in the blood? That is glucose. Glucose is the trigger factor which brings the insulin in the blood. Thank you.